Over the years, the concept of a perfect smile has gained more and more importance, including straight and light colored teeth. Tooth whitening has become a veritable means for providing that perfect smile. Tooth discoloration was described as any change in the hue, color, or translucency of a tooth due to any cause. Hue refers to the pure spectrum of colors, which is the basic color of a tooth, such as red, blue, green, yellow, whereas translucency is considered as the fourth dimension of color. It can be defined as a gradient between transparent and opaque. Prior to discussing the process of bleaching, let's first take a look at the causes of tooth discolorations. We shall discuss it color-wise. Black discoloration. It can be either intrinsic or extrinsic. Intrinsic discolorations are incorporated into the tooth structure, whereas extrinsic discolorations are attached to the tooth surface. Both these can affect either enamel, dentin, or the pulp. So, the extrinsic causes for black discoloration of teeth are areca nut and betel quid use can lead to pigmentation and staining of teeth. That is also deleterious to the periodontal health of the person. Absorption of chromogens into the porous dentin can also lead to black discoloration. The chromogenic bacteria is also associated with recurrence of staining after scaling and polishing. Tea and coffee have higher levels of both acids and tannins, which can result in staining of teeth. Dental plaque is a biofilm of bacteria that grows on the surfaces within the mouth. Deposition of these tartar-like substances can lead to black discoloration. Occupational exposure to metallic salts and a number of medicines containing metal salts can lead to development of metallic stains. Black stains can be seen in people using iron supplements and iron foundry workers. The tar and nicotine in tobacco also leads to teeth discoloration. Drinking a lot of red wine can also stain your teeth, so it is always advisable to avoid acidic wines and drink plenty of water with it. Now, the intrinsic causes of black discoloration of teeth. Amalgam fillings over time will undergo corrosive changes and degradation with byproducts causing color alterations in tooth structure. Whereas glass ionomer restorations may leak at the margins and allow for discoloring agents to penetrate into the tooth and dentinal tubules. Iron from heme following pulpal hemorrhage forms iron sulfides, which may reach dentinal tubules, causing discoloration of surrounding dentin. Minocycline, which is used in revascularization procedures in dentistry, can lead to deep dark stains. It affects both enamel and dentin. Whereas metallic filling materials such as gold can also cause black discolorations. Gold fillings such as gold foil compaction fillings, inlays or onlays, but also pins and posts can cause color changes, reducing the translucency of teeth and also adding dark hues throughout the thin remaining tooth portions. The next shade of discoloration that we shall discuss is gray discoloration of teeth. The intrinsic causes for gray discoloration of a single tooth are metals such as silver and gold alloys, and silicate compounds such as MTA, that is mineral trioxide aggregate, which is a dental material used for epixification, perforation repair, root and filling, and revascularization procedures. MTA may discolor teeth and adjacent soft tissues. The discoloring effects can be either gray or white in formulations. Whereas the causes for intrinsic gray discoloration of multiple teeth are dentinogenesis imperfecta, which is a group of hereditary autosomal dominant genetic dentin disorders characterized by an abnormal dentin structure. It can affect either primary or both primary and secondary dentitions can be affected. And the second cause being thalassemia, which is a blood disease causing characteristic malformations of the skull and long bones. It can also adversely affect the color of teeth. The next color of discoloration is red or brown discoloration. The extrinsic causes for brown or red discoloration are coffee or tea, dental plaque, doxycycline, which is an antibiotic used to treat diseases such as urinary tract infections, chlamydia, and acne. It was frequently used from 1950s through early 1980s, and particularly in young children, it can cause brown or deep dark stains that may affect the entire tooth or occur as a pattern of horizontal stripes. Adults can also suffer from doxycycline stains on their teeth. Drugs such as khat and marijuana. Historically, cannabis has been smoked as marijuana, but it is increasingly available in other forms as well, such as edible and topically applied products. and cannabis smoking has been found to be associated with staining of teeth as well as periodontal complications. Iodine containing intracanal medications or halides can also reside in the root canal space and start gradual discoloration by penetration of dentinal tubules through oxidation. Exaggerated use of mouth rinses such as chlorhexidine have also been found to be associated with staining of teeth, which can be removed via scaling and root planing. And the other extrinsic causes of red and brown discoloration are tea and coffee and wine. The intrinsic causes of red or brown discoloration associated with a single tooth are dental caries. The discoloration occurs due to the formation of melanin or lipofuscin, the sugar-protein reaction, also known as Maillard reaction or non-enzymatic browning reaction. Cervical root resorption can also lead to pink discolorations of teeth. The granulation tissue of the resorptive defect may be visible through a thin dental enamel layer, giving the characteristic pink spot appearance. Composite resins and glass ionomer restorations, which may leak at the margins and allow for discoloring agents to penetrate into the tooth and dentinal tubules. Dental trauma, which may expose the underlying pulpal tissue. Endodontic irrigation solutions, such as sodium hypochlorite, which can discolor dentin based on its destructive effect on the RBCs and the ability to crystallize on the dentin surface. And resorcinol formaldehyde resin paste, also known as Russian red, which can lead to pink to dark burgundy discoloration of teeth. Iodine minocycline, which is used in revascularization procedures of periodontal tissue. Pulpal trauma with hemorrhage. The intrinsic causes of brown or red discoloration affecting multiple teeth are amelogenesis imperfecta, which affects enamel in the primary and secondary dentition as well. Enamelin is associated with variable hyperplasia, whereas amelogenin is associated with hyperplasia to hypermaturation to hypomineralization. The other cause being congenital erythropoietic porphyria, which is a disease resulting from abnormalities in the synthesis of porphyrins, organic compounds essential for the function of hemoglobin. Dental trauma, dentinogenesis imperfecta, types 1, 2, and 3. Dental fluorosis, which occurs after excessive exposure to fluoride during tooth formation. It can lead to alteration in the mineralized tooth structure, especially in the enamel matrix, and gives the appearance of a mottled tooth. Tetracycline and thalassemia. The next shade of discoloration is green discoloration of teeth. The extrinsic causes for green discoloration of teeth are chromogenic bacteria, metals, tea and coffee. The intrinsic causes for green discoloration affecting multiple teeth are hyperbilirubinemia. Hyperbilirubinemia can be caused by erythroblastoma fetalis. Bilirubin is a yellow breakdown product of hemoglobin which can get incorporated into developing teeth, creating yellow-green or blue-green discoloration. And the next cause being thalassemia. The next shade of discoloration is orange discoloration of teeth. The extrinsic causes for these are chromogenic bacteria, metals, and doxycycline. The next shade of discoloration is yellow discoloration of teeth. The intrinsic causes for yellow discoloration affecting a single tooth are caries, composite resin or glass ionomer restorations, and trauma. Whereas the intrinsic causes affecting multiple teeth with yellowish discoloration are aging. With aging, the enamel becomes thinner, and there is also an increase in the development of incisal wear, crazed lines, and cracks, which allow easy penetration of discoloring agents. Amelogenesis imperfecta, dentinogenesis imperfecta, dental trauma, dentin dysplasia. Dentin dysplasia is of two types, type 1 and type 2. Type 2 is associated with mutations in the gene encoding for dentin silophosphoprotein or DSPP, fluorosis, and lastly, white discoloration of teeth. The intrinsic causes affecting a single tooth discoloration are caries or dental trauma, and white discoloration affecting multiple teeth are, the causes for that are calcific metamorphosis or dystrophic calcification, in which case mostly the anterior teeth are affected. Fluorosis, infection during enamel formation, high fever during ages of tooth development may cause chronological enamel hypoplasia, which can lead to a banding type of discoloration, and nutritional deficiency such as that of vitamin C and vitamin D. Rickets, that is the deficiency of vitamin D, can lead to white hypoplasias, whereas scurvy, a deficiency of vitamin C, along with vitamin A deficiency and phosphorus uptake disturbance, can cause enamel hypoplasias. The most common classification for tooth discoloration was described by Natto, and it defines three classes. The Natto type 1, wherein the discoloring agent, which is the chromogen, binds to the tooth surface with a color similar to that of dental stains caused by chromogenic bacteria, tea, coffee, wine, and metals. The Natto type 2, the discoloring agent is a Natto type 1 food stain that changes color to darker after binding to the tooth surface for a certain amount of time. And Natto type 3, wherein a pre-chromogen, or in its base state, colorless material, binds to the tooth and causes a stain after chemical reaction. These types of stains are often due to carbohydrate-rich foods such as apples or potatoes, stannous fluoride, or chlorhexidine. So this was about the various causes for tooth discoloration. In the next presentation, we shall discuss about the bleaching agents, their chemistry, the process of bleaching, the complications and contraindications of bleaching, and we shall also discuss how safe it is to bleach our teeth. I hope you have liked this presentation. Please do like, comment, share, and subscribe to the channel. Thank you.